Greeting guys, my name is Iman and today I'll be discussing with you the essential steps to dispensing best practice. Dispensing is more than sticking a label on a bottle. It may be perceived as an easy job and only involving putting a label on a box. And we may have heard patients complaining about the waiting time and wondering what is taking so long. In this article, the Pharmacy Guild of Australia highlights the importance of dispensing and reiterates that dispensing requires the professional and clinical review by a pharmacist, which involves many steps. PSA defines dispensing as the review of a prescription and the preparation, packaging, labeling, record keeping, and transfer of the prescribed medicine, including counseling to a patient, their agent, or another person who is responsible for the administration of the medicine to that patient. And when dispensing medicines, pharmacists should ensure that the prescription is valid, medicine is clinically appropriate for the patient, and information is provided to ensure safe and appropriate use of the medicine. Even the World Health Organization recognizes the importance of dispensing and has put together a whole document about it. Here we see the comparison of dispensing process suggested by PSA and the Guild of Pharmacy. Feel free to pause the video and have a look at the different diagrams. After looking at all the resources out there, including PSA, Guild, APRA, as well as the World Health Organization and PDL, I've put together this following diagram of the essential steps to dispensing. Firstly, we will discuss what is involved at receiving and validating a script. Then we would like to go in more details about gathering information, reviewing prescribed medicine, making a clinical decision, preparing dispensing and checking, then finally issuing the medication to the patient with clear instructions. But firstly, we'll have a look at receiving. So let's have a look at the steps that are involved in receiving and validating a prescription. Firstly, you always want to consider privacy for any situation in the pharmacy where a patient approaches you. Secondly, you want to check that the script meets legal requirements when you see it. After a lot of practice, you will be able to scan the script immediately when you receive it and check for the following, for example. Script date. We know that for S4s it takes 12 months to expire and S8s is 6 months. We need to check that the signature is available, for example. We need to check PBS eligibility, for example, if the medication is covered on concession, if it's an authority prescription, that all the authority requirements are met. Okay. Should also be checking the patient's details are correct, their address, and the prescription has all the information required to dispense the medication, such as a medication name, form, strength, and quantity. Directions are all present. We need to know about the patient's brand preference, for example, but we cannot substitute if the doctor has indicated on the prescription that substitution is not allowed. And when substituting a medicine, we should always be considering the equivalence data. By equivalence, especially for biosimilar medicines as well. Furthermore, if it's an SA script, legally we are looking for certain things. I won't be going in details about that today, but you should be calling the doctor if you're not familiar with the handwriting as well, and if the information is missing from your prescription about the legal requirements for SA scripts. Here's some examples of different types of scripts written by different prescribers. They do look different. Have a look at them and check the layout of each of the prescriptions. For example, for a general practitioner, a computer-generated script looks like this, whereas a handwritten script looks like this, and this is how an authoritative prescription looks like for a general practitioner versus an optometrist, a nurse practitioner, and this is for a dentist. The next step should be gathering information after you receive and check validity of the script. Okay, so before asking further questions, you should always be asking the patient for permission to do so. Shown here is the medical mnemonics for gathering information from patients effectively. If you do consider all the following already, that's excellent, and you might have your own style and flow at asking these questions already. But the more you gather from the patients, the better you'll be able to assess the safety and the appropriateness of the medication. I can't stress enough the importance of asking for both medications and medical conditions, as one does not substitute for the other. For example, if a person has asthma but does not take any preventers and does not use their asthma frequently, they may not mention that they're on any medicines. Therefore, it should not conclude that they also don't have any medical conditions, for example. You may want to ask for age to determine if the medication is appropriate for age, weight to determine if the dose is appropriate, and height and maybe even weight. If you are calculating body surface area, you need to know if it's a female of childbearing age, if they're pregnant breastfeeding, to assess the appropriateness of the medicine in pregnancy and breastfeeding. But also you need to know a bit more about the symptoms. You may wish to go a bit further than just asking what the symptoms are, and I'll show you another medical mnemonics later that explores a little bit more details in certain situations and medical conditions. You may need to know a little bit more details about how acute or chronic the condition is, if they've tried anything or not, as all of this information can help us determine whether the medication is appropriate or not. When you're asking about medications, don't forget that some people may not consider medications as the same as the OTC or natural and herbal medicines, vitamins, minerals, and supplements. Therefore, you do need to ask, on top of what medications you are on, you need to ask further details on anything over the counter they're taking, or natural, herbal, vitamins, minerals, or supplements. And you always need to check for allergies and confirm what type of allergy it is, because sometimes it could be the difference between not being able to use this medicine at all, or maybe using it with monitoring, or maybe there's a cross reaction between different types of medicines, and maybe they can also get the same reaction from this or not. So further information that may be useful include things such as diet, stress, sleep, smoking, alcohol, and caffeine. Okay, so smoking, for example, we know it can affect COPD, so we need to know whether the patient with COPD is smoking, as we need to advise them maybe to quit smoking. We need to maybe know if a patient has been traveling, maybe their diarrhea is due to their travel. We may need to know occupation, for example, as it may be making their condition worse. For example, dermatitis on the palms, hairdressers on the hairdresser's palms, which may be prevented by suggesting to use gloves, for instance. Okay, so further mnemonics. This is about symptoms, and it can give us a little bit more information if it's to do with back pain or maybe even a skin condition, and to help us differentiate between those different conditions and to see whether it's more serious or less serious. So L for location, the intensity of it, nature and duration, onset, any other symptoms, the aggravating, elevating situations, if it's radiating, for example, down the leg, or how frequent is it happening. Okay. And never forget to check the dispensing history. If you've got any dispensing history, can be useful to determine any interactions and further appropriateness of the medication in front of you. Okay, so the next thing is we need to review the prescribed medicine to see if it's appropriate or not, and all the information we've gathered. So in your review, you need to consider the following. If it's appropriate for the condition being treated, if the dose aligns with the medical reference recommendations for the condition being treated, if it's safe and appropriate based on weight and age, for instance, if it's suitable frequency, route of administration, and duration of treatment, if it's compatible with the patient's current medical conditions and allergies, and if it's compatible with other medications being taken. Okay, then from your dispensing history, you should be able to check the following. If the medication is new or changed, if this is a duplication in therapy or an interaction exists between prescribed and current medications, check if the patient is compliant with their current medications by checking the dispensed frequency, and if they potentially are given another medicine for the same condition due to poor compliance, for instance, it becomes an intervention. In the same way, you also want to check for unusual use, misuse, or abuse issues and report them to the doctor. Then we make our clinical decision based on the review and all the information we gathered. So if there are no issues, then you can continue to dispense the medication. If issue or issues do exist, you need to discuss with patient and contact doctor if necessary. In order to present drug-related problems in a logical manner to GPs, we should be adopting the SOAP format, which is commonly used to document clinical notes. The subjective objective assessment plan is widely used in medical practice, and it helps simplify the communication and the documenting of issues and problems about patients. The following includes language to consider when communicating with the doctor or other health professionals. Should apply to when you're communicating verbally as well as through written communication. When communicating with a prescriber or other health professionals, the pharmacist should specify a particular concern, provide supporting evidence, and suggest appropriate alternatives. Ensure that you have all the information and suggestions ready before you make the call. Ask for patient's consent when required. Reintroduce yourself. Confirm patient's details such as the full name, date of birth and address, medication prescribed and what you're calling about, and the script date if necessary. Present the case ensuring to avoid accusations, and try use the SOAP format discussed earlier if possible. Using the SOAP format, present your suggestion, which is the plan, quoting any references used, for example, to back up your suggestions, and document on dispensing program using again the SOAP format and annotate on the script. Annotation should include which doctor was contacted, the decision made, and date and your initials. You may need to ask for a new prescription in some cases, and the full supply can be issued upon verbal order from your doctor. After you've resolved any issues, or if there wasn't any issues, proceed to dispense the prescription. Here's a guide put together by PDL and AJP based on the QCCP program, listing a number of routine checks and procedures for guidance in order to minimize the potential for dispensing errors. It's strongly advised to observe them on each occasion a pharmacist dispenses a script. This may overlap on some of the steps that we discussed leading up to now, but what I want you to take away from this is steps 2 to 8, which surrounds dispensing, selecting the medication, and labeling. Make sure you read all of it, pause the video, and make sure you are very familiar with this. The final step is giving out the medication and counseling. Patient counseling is an important part of the process of dispensing medicines. It's a two-way communication process between the pharmacist and the patient. It provides an opportunity to elicit the necessary information from a patient and provide the required information to enable safe, effective use of medicine, and is the final check-in process to ensure the correct medicine is supplied to the correct patient. When dispensing repeat prescriptions, counseling provides the opportunity to ascertain the patient's taking the medicine correctly, if the medicine is having the desired outcome, or if there are any unwanted side effects. Lack of counseling can be a significant contributor in failing to detect dispensing errors. In this regard, the board endorses the current patient counseling guidelines produced by PSA and the Society of Hospital Pharmacists of Australia, including the use of consumer medicine information leaflets. Pharmacists should make every effort to counsel or to offer to counsel the patient whenever a medicine is supplied. Patients in all pharmacy settings have the right to obtain the information about their medicines. However, the pharmacist must respect the right of the patient not to be counselled if they don't want to be counselled. Counselling should take place in an environment that recognises the patient's rights to privacy. So you should always be considering that first. You should also be checking the name and address of the patient before handing out the medication, or get the patient to tell you their address so you can confirm. I had once two people with the same first and surnames waiting for their scripts to be collected at the same time. So lesson learned from that is always check at least the address or something else, and get them to say it to you rather than you call it out, because you can still have patients saying yes to anything you call out because they're in a rush and they can't hear you properly. Okay, so you need to at this stage discuss any changes or any outcomes coming out of the doctor's call that you made. Then you need to explain the purpose of this counseling session before you actually proceed to counseling, so that the patient's aware of what you're about to talk to them about. So if it's a new medicine, you may want to consider the following points to cover in your counseling. Before you start, you may also wish to find out what the doctor has already told the patient about the medicine, or what the patient already knows about the medicine, so that you're not overlapping on some of the information they know. You may wish to include the name of the medicine, brand, strength of the medication you're given out, and highlight any brand substitution if you did change the medication to a generic, for example, to reduce confusion in future. And try to engage your patient during the counseling, as it can be difficult to absorb everything if you were just talking at them rather than having a conversation the whole time. For example, you might want to ask if what they already know about their medical conditions and how the medication is working or going to help them with their medical condition, and correct any misconceptions and add to any of their missing knowledge. You may also wish to print in some information about this, or give out a CMI or a resource such as a website to help them remember this information better or later on. Okay, you need to talk to them about how to use their medicine correctly. For example, should they be taking 1 or 2 tablets of 5 milligrams of this medicine, or should it be 5 mils of this medicine? And you need to talk to them about when to take it in relation to food, or in the morning or evening, or with other medicines. How to take the medicine. Should it be chewed, swallowed whole, taken with plenty of water, etc. You need to talk to them if they're going to be taking it every 4 hours or every 6 hours. If it's going to be twice a day, then does that mean I can take it in the morning and again in the afternoon, early afternoon, or should it be spaced out by 12 hours if it's twice a day? Maybe it's a slow release formula, so it has to be every 12 hours, for example. Is it going to be every 4 hours during the day, or does that include during sleep time? If you're giving a medication that has a very frequent dosing, you need to highlight that that's during waking hours, for example, so that the patient doesn't think that they have to get up at night to take the medicine. You can also give any or go over any cautionary and advisory labels as well, because they can help also supplement the verbal communication as well, and can help the patient remember the information. You also may need to demonstrate how to use any devices, such as a small inhaler, for example. You should also talk about common side effects For example, all medications have side effects. It's important that the patient knows what side effects are normal and what side effects are dangerous, together with actions to be taken when adverse reactions or interactions occur, for example. So you can talk about the top 3 common side effects which may occur, and few serious side effects which may need to be reported. To give out a CMI, for example, and highlight all the other ones they should be aware of and that may occur. However, you need to avoid scary jargon such as this medication is toxic. Try and use lay term as well. You need to talk about expiry if it applies to the medicine, if it expires in after compounding, for example, 28 days, or after mixing, such as antibiotics, 10, 14 days or 7 days, for example. After opening, such as a Classic eye drop. Storage, should it be kept in the fridge? For example, Classic eye drop doesn't need to be kept in the fridge after opening, but before opening it's kept in the fridge, and so on. You also need to talk about length of treatment, especially if it's to do with a chronic condition. Chronic conditions, it's important if it's the first time they're on this medicine for a chronic condition such as diabetes, that you mentioned that this is going to be an ongoing medicine for them, and they need to be taking it ongoing, therefore, and continuously. And you need to tell them when to expect improvement, for example, if it's a chest infection, and if things are not improving for an ear infection or a chest infection, when should they see the doctor again, and so on. In some instances, you may need to counsel on other options that may help, including other products and/or lifestyle advice. For example, products that may be recommended to manage side effects. For example, laxatives with pain medicines containing codeine, for instance. And you need to also provide supplementary information such as self-care cards to assist the patient's understanding of their condition or medication management issues. CMIs and ancillary labels and cautionary and ancillary labels can also be used to supplement verbal counseling. Finally, you need to confirm the patient's understanding, and you may need to ask them to repeat the instructions back to you. Finally, you need to consider the following situations when you're counseling. You may come across people from different backgrounds, religions, and culture that also require counseling, and you may have issues with delivering the information. You need to be able to think about how you would actually give out this information, and be able to communicate with these patients. It may mean that you need to supplement the information heavily with written information for a person with language barriers. Maybe give out a CMI or a self-care card on their medical condition printed out in their language, or maybe even calling a translator or a member in their family to translate, or drawing a diagram on how they should be having their medications. For example, if it's an agent or a carer, such as mums, when you're communicating to mums, you need to change the way you're wording yourself, so it's not counseling directly to the patient, and also you need to consider religion and culture. For example, a Muslim lady might not or would prefer to be counseled by a female pharmacist on certain medical conditions as opposed to um, uh, getting counseled by a male. And in impaired hearing, you may need to be a bit more clear and louder as well with your counseling. And there are a lot more other situations you need to consider, but these are just some of the examples. So that's it. This is the end of the presentation. Thank you so much for watching. I hope you learned something new and you enjoyed it. And until next time, thank you.